Right now we are going to move the other details, the middle cerebral artery, discuss the hemisphere. When I am draw this hemisphere lateral side, mainly frontal area, occipital area, parietal area and temporal area. In this lateral hemisphere, what is the area connection with the middle cerebral artery? The lateral cortex area, mainly major superior circulation supply and inferior circulation supply. We can see the proximal, not the proximal, distal part divide the middle cerebral artery. It is ending branch, ending branch, the cortex area. Concerning the lateral side, frontal area, not the frontal area, the posterior frontal area is the covering circulation supply to the superior middle cerebral artery. The medial sulcus, central sulcus, just the most important sulcus. This is the central sulcus. Divide the anteriorly motor part, posteriorly sensory part. This central sulcus, the superior margin not give the middle cerebral arterial supply. The superior margin is give the anterior cerebral artery. I am going to draw the special point. Why we are drawing this? There are some patient having middle cerebral artery damage or embolism or some form of uh, occlusion, the perfusion. They have some form of mobility of the leg, contralateral affected side leg mobility not affect, it can move. I'm going to discuss that point using the cortex motor area. This is the coronal cutoff, the brain, the motor area, primary motor area, the some form of connection with the voluntary movement of the half of the body, leg, trunk, and upper lip and face, how to affect the damage of the middle cerebral artery. This is the leg area. This is the hand area. This is the neck and face and tongue. The middle cerebral occlusion area I'm going to draw. This area can be damaged. The lower limb, sometime the middle cerebral artery damage of the contralateral side, leg movement, some form of leg movement, voluntarily he can do. That's some form of major point to identify the patient having the middle cerebral arterial damage. Then we are going to another area. What is the another area? Damage to middle cerebral arterial occlusion distal part. Central sulcus, primary motor area, most anteriorly, free motor area, and posteriorly sensory. Somatosensory area, the sensory area also the same diagram. The leg area, contralateral affected leg area sensory, some form of sensory, not lost the leg. Then talk about the anterior to the central sulcus. Premotor area, supplementary motor area, then both connect the motor area of the face, leg, mouth, neck, trunk, and upper limb. Sensory area, somatosensory area, the primary somatosensory area also therefore. This is the speech area. When we are going to talk about the middle cerebral arterial damage, aphasia is the divide two part, motor and sensory aphasia, expressive and comprehensive aphasia. This is the Broca's area. This is the Broca's area. This is the comprehensive speech area. It's the Wernicke's area, Broca's area, and Wernicke's area. Also, the major speech fluency of speech and comprehensive identify the speech area. These two, the fast speech, fast memory speech, identify speech, and capacity of the speech, and memorize of the speech, the naming, and some form of is alexia also. the small mathematics system also the inside of this area. Right. This is the major aphasic area, the middle cerebral artery damage, patient having this broadcast and 1x speech area damage. Then the posterior side of the sensory motor area, there are some form of the is facial identification area. Is facial identification area. Then the left side, right side identification, the around the environmental identification, some form of space identification problem having this middle cerebral arterial patient. Then the lateral sulcus, talk about the lateral sulcus. This is the lateral sulcus, below the lateral sulcus, temporal area, above the temporal area, superior temporal area, damage to the inferior supply of the medial cerebral artery. This temporal area mainly connect with the sound area, auditory area, then connect with the memory, some form of intellectual area, some form of gesture area. In this around this area, the lot of problem having this patient. Now the most important to anterior part of the frontal lobe, it is the lot of memorized area, intellectual area, judgment area, thinking area, debate area, and cognitive function area. The lot of past memory and recent memory, lot of are there in this area. The middle cerebral arterial damage to the lot of cognitive function, intellectual function, damage these patient. But the major point is the alert and attention. It is the most important, alert and attention super in the and in this patient. Why? Alert damage to the vertebral arterial supply. Medulla forms midbrain. In between these three, there's a retinacular formation. Retinacular formation is the alert switch. Alert switch. It is not damaged. This patient alert is mainly good. That's the main point of this middle cerebral arterial patient, damaged patient. Now we are going to discuss some form of special words inside this parietal, temporal, and broadcast area damage patient, the middle cerebral artery damage patient having some form of special find. Right? These are the major point we have to discuss. Aphasia, due to this middle cerebral artery damage, global aphasia can be happening to this patient. Apraxia, apraxia is the sequence of motor movement damage. He can't do in the sequence of activity continuously. That is the apraxia. So dressing apraxia and construction apraxia. So a lot of apraxia happening. Hemibalasmus of the visual field, hemianopia also the visual field, damage of the optic nerve, chiasma, optic nerve tract, the lateral side of the affected contralateral affected area, lateral side of the visual field damage. Alexia, can't write, can't read, can't identify the words and can't identify the picture, can't identify the some form of face, alphabet, a lot of problem happening. Dysphagia also the solving problem or muscle weakness of the solving pharyngeal area or some form of brain stimulation problem, the vocal cord, sensory loss, contralateral sensory loss of the hemi paralyzed area. A calculus if a small mathematics sub can't correct left right discrimination, can't identify the what is the left, what is the right, hemi neglect, lot of problem of the hemi neglect. When the patient ambulation, the hemi neglect, lot of here is walking the one leg and one side weight bearing. That is the most can't correct the that situation. It is the most important point. Burning sensation, the contralateral affects the face, hand and leg to feel lot of burning and troubling and irritation sensation. That is the most important another point. Pain also the hemicide. Another special point. Finger nausea. Can't tell the what is the finger, what is the small finger, what is the thumb, what is the middle finger. Can't identify the finger. That is the most important. Another point to having this middle cerebral arterial damage patient. Right? In briefly, that is the most important point. Again, I am going to talk these things. The brain damage occur in the middle cerebral artery, emboli or malformation of the arterial and venous supply. That is the another problem. Or some form of aneurysm and stenosis occur in the arterial area. That is the another affected point. And some form of the tumor complex the artery. That is the another point. And inside the brain some pathological factor can be happen. It is the another point. Some form of still circulation. This is the pathway to not going to the upward, go the downward only circulation. That is the still circulation happening. It is the superior arterial area can be damaged. Then the ischemic stroke also happen in this area. It is also the can be infarction. That is the major arterial block I told you. Then the happening damage this area. What is the major sign and symptom we can see the that patient? Aphasia, Bocast and Warnick's area. This the aphasia can be the global aphasia, apraxia, sequence movement can't do, hemibalasmus and hemianopia, the visual field, some form of assist the visual field, happen in some form of damage, alexia, can't write, can't read, can't identify face, can't identify object, can't name it. That is the most important point. Dysphagia, the swallowing problem, sensory lost this area or sensory aggravated this area or numbness and various sensation happen in this affected hemi area. Acalculia, small mathematics, some can't correct left and right discrimination, can't identify left side and right side. Hemi neglect is the most important. The affected side, the patient neglect the affected side. He can't identify there are some form of site of the affected area. He does not there are the area and neglect totally this area. Burning sensation, pain and finger ignore. agnosia. That is the most important point we discuss now today. Conclude this session. Okay, goodbye.